Well, hello, I'm Dr. David Wipperman, and when it comes to discussing some of the core nutritional products I recommend for my patients, vitamin D has to be high on that list. You see, the human body contains roughly 30,000 genes, and vitamin D has been shown to influence 10% or 3,000 of them. This is the main reason why vitamin D is so crucial, because the effect it has on so many diseases we face, like heart disease, cancer, or diabetes. You may not know this, but vitamin D isn't really a vitamin. It's a steroid hormone produced in your skin from exposure to the sun. You also acquire it from different food sources and different nutritional supplementation. Now, there are mainly two forms of vitamin D, vitamin D2 and vitamin D3. D2 is found in milk, juices, and cereals, while D3 is synthesized in your skin from sun exposure and is considered the real form of vitamin D. Now, a study in January 2011 out of the Journal of Clinical Endocrinology and Metabolism found that vitamin D3 is 87% more effective than D2 and is the preferred form of treating vitamin D deficiency. So, what's the normal range for vitamin D, and how can you be tested to determine if you have a deficiency? Optimal ranges for vitamin D, whether you're a child, an adolescent, an adult, or a senior, is 50 to 70 nanograms a milliliter. Even though some labs will say the range only needs to be between 20 to 56, the fact is that vitamin D should never be below 32, and optimal ranges are from 50 to 70. Now, most blood labs like LabCorp and Quest offer these tests. However, there's a word of caution I have for you. There are two vitamin D tests currently being offered, 1,25 OHD and 25 OHD. 25 OHD is also called 25 hydroxy vitamin D, and it's the better marker of your overall vitamin D status. Now, unfortunately, the reason most of us are deficient in vitamin D is because we don't spend 15 minutes a day, at least 3 times a week in the sun. And if we do, we usually lather up with sunscreen that blocks out most of the UV rays that help produce the vitamin D in the first place. So, if you haven't been spending that much time in the sun, then I recommend supplementing your diet with vitamin D. The amount of it you need on a daily basis is specific for each individual, and we'll be happy to determine what that is for you. Now, there are several products on the market, but not all vitamins are created equal. I pride myself in researching and finding the best, most bioavailable forms obtainable for my patients. So if you're interested in improving your overall health, including your immune function, then give my office a call and set up a nutritional consultation. I'll sit down with you personally and we'll get you back on the road to wellness. Have a great day.